thank you, friend, for coming for this prostate massage treatment mainly. We call it Istanbul protocol, and we have some Russian instruments, but the main thing is prostate massages. And we do it 5 days succeedingly. The aim is, you asked me the aim, right? What did you ask now?
Yeah, I asked you, well, what does it actually do, the use of the instruments and the prostate massage?
Yeah, the instruments and the prostate. We first do hit the prostate with the instruments. We have a couple of instruments. One is, for example, vacuuming the penis. For me, it is nonsense, but the Russians are insisting, use it. It's also pulling some blood into the prostate.
I did wonder what this was for.
Yeah, this is, it's making vacuum, like a vacuum device that is used in erectile dysfunction, just making a vacuum in the penis, and this vacuum also pulls some blood into the prostate, which is good because we want some circulation inside the prostate. Prostate is a very sacred tissue, hidden tissue. There is not too much circulation inside. There are some inflamed tissues that are not drained. So we want drainage there. So this device, first device, vacuum, and it gives some blood. And the second device is we put it from the rectum, and around it, it makes a heat, like a microwave oven. It heats the surrounding, and this prostate is heated by it. Third instrument, again, like a light bulb, it also heats the prostate. These are all... and
one of them feels like it's vibrating.
This is a Chinese instrument. This is like real, it's a vibration. And these vibrations, as this one may also work the same. When it vibrates, it makes the tissues vibrate. So we want the circulation and drainage of the prostate. So we all perform these, then the torture begins. It's the important part. It's painful. How do you score the pain of the prostate massage over 10? 10 is the most painful, 0 is the...
6 to 7.
Okay, this is logical, this is true. If someone says 0, okay, this is not routine. Okay, it may happen in someone. Or if he says 10 over 10, it's not true. It's extreme. So 6 to 7 is good. It's really uncomfortable. But, so after hitting the prostate and making some circulation there, we squeeze the prostate. What do we aim with this? Why other people are not performing it? And what's our aim? Our aim is that in the prostate, we see by our experience and with the experience of the Russians and also the American medicine, Western medicine was also performing this previously, maybe in 1960s, a little old, before these medications come out, but they were doing it. So when we squeeze the prostate, we try to drain the prostatic fluid. Mainly what we do is that. And at your first massage, you had a couple of drops, which was a little bloody. Yeah. This is what we want to take it out. By this, we want to empty the prostate, which is giving some stretch to the prostate and the irritations, the discomfort. And we find Enterococcus bacteria inside this fluid, which was never positive in your
never
tests.
shown before, ever, on any test.
Yeah, because if this is the prostate, for example, there are hidden cavities, like caves, and this fluid is not coming out with ejaculation, with urination, it's hidden there. Okay. So you have the test from urine, from semen, such things.
Yeah, I had both, and that showed nothing. Only previously urea plasma, I told you, long time.
This is the channel here inside the prostate. There is a channel. The urine passes from this channel. If the infection is too much, maybe some bacteria will also join to the urine and they will come out. In extreme infections, okay. And in semen, the fluids come from seminal vesicles, from testis, let's say, very little amount. Okay, from the prostate too. But from prostate, we are looking for the undrained, obstructed places. So when you ejaculate, this is not coming out. If it was coming out, there would be no problem. Yeah. The cavities, the inflamed parts are obstructed. How you can translate my English to English, what I'm trying to say, maybe you can better
I
tell
understand.
So these are trapped places. Why it is trapped? So inside the prostate, there are channels like this, okay? there's a fluid is produced to milk the urethra, to soften the semen, to make it travel better. And they are produced here and then travels from these little tiny channels to the urethra. And when you ejaculate, they go away, they are drained. But when bacteria come in, the bacteria may distract the pipe, may distract the ductus, which we call the place where the fluid is produced. So when they make a distraction here or here, the produced prostatic fluid cannot find its way out. And it is gathered here. If it is infected with a bacteria, like you had the enterococcus, the inflammation makes more irritation. If you have lots of antibiotics and clean the infection somehow, which is sometimes possible, you have no infection, no bacteria, but still there is a fluid which is not finding its way out, so it is irritated. What we do is we squeeze the prostate, and we are pushing this fluid out. This is what we try to do. It's really, in my experience, it's successful, really successful. The problem is it needs some repeatings. It has to be done a couple of times. This is why I am trying to find a way for yourself to do it yourself with your own finger or with some massage device when you go back to your country. Fortunately, you live in a closer country, not in the UK.
Yeah.
Maybe it's easier to come from the UK.
Dubai is 3.5 hours. So
Yeah, same for London, right?
similar.
Yeah. And from London, every plane is very cheap.
I don't know. I haven't lived there for a long time.
Really?
But,
Okay. They are finding always some way. So this is what we do. I will recommend you to try all of these. I show this in you. I'm sure you've seen this video with yourself massage. Or the best is, if it's possible, come one more time.
I will come back again, Dr.
Yeah.
Yeah. I have some other questions
Yeah.
that I prepared myself.
Yeah.
So, why, with this prostate issue, am I getting lower back pain? What is the relation between the prostate and lower back?
Yeah. Again, with experience, I see many patients who the pain is radiating, like your heart. When you have a heart disease, people come to emergency saying that, oh, I have a left arm pain. We say, okay, this is heart. They say, no, it's left arm. No, it's radiating. Prostate is an inner organ. Inner organs doesn't have their nerves, sensory nerves. So their irritations always radiate to some part. We usually have the pain in the perineal region. This is the sitting part.
Yeah, I have perineal pain.
Yeah, they say, I'm sitting on a tennis ball, ping pong ball, such things. Sometimes we have the pain in testicles. Sometimes we have the pain in penis. Sometimes back pain, belly pain, shoulder pain, arm pain. I even see arm pain. I said, okay, this is not. He was saying, I have prostatitis, dysuria, and symptoms here. Also have arm pain. I said, okay, this is not related.
Yeah,
It was related. It was related because this is an inflammation inside your body. So the body is always in a chronic low stage war.
Okay.
And your muscles, when the prostate, there is some inflammation, the surrounding muscles always in distress and contracting themselves. Like if you have an infection here, you will stay like this, cramped, okay? And the muscles around the prostate, they are always in semi-contraction.
You know what's strange for me is that when I had this prostatitis a few years ago, I had this tennis ball feeling. But this time, it's in my rectum. It's a burning. It's not the tennis ball feeling. It's more of a burning in my rectum. It's different on this episode.
Of course, we are not sure if it is related to prostate or if there is a rectal issue. But usually, all rectal pains disappear in a couple of weeks. There is no chronic rectal pain disease, but chronic prostatitis is more.
The other question was, okay, the bacteria that was found, the enterococcus.
Yeah.
Do I need to inform my girlfriend of this?
Good question. Actually, theoretically, when you ejaculate, it's not coming out. So in ejaculation or in normal sex, when the normal fluids are coming out, you don't have a chance to infect her before. But now we open some of these channels. So in your ejaculate, even you may have these bacteria.
Okay.
So you first don't ejaculate inside.
Okay.
You can do it outside.
Because I've had the 3 gentamicin injection there.
Yes, you had them, but still you may have bacteria inside, and you are now have the risk of infecting her. Previously it was less risky, now maybe more.
Because in the last couple of months we both had tests, both totally negative.
Yeah.
So even
So
for her,
at-
totally negative in culture for her.
At that time, you don't have the risk of infection because
Because
your
it's locked inside the prostate.
yes.
And now maybe
Now-
it's freed up, so it could
Yeah,
be
yeah.
could be for okay. The other thing is, in the morning when I first awake, the pain, I feel like it's not there. I feel like within a few minutes of my central nervous system waking up, that it becomes ampler. It's like my brain is looking for the pain. I think there is some psychological element. After 2 years of the pain, I
Yeah.
feel like there's a psychological element with me.
Yeah,
Or
it
and
makes
muscular,
sense.
and
It makes
muscular,
sense,
and
yeah.
muscular also.
I think people are always talking about such symptoms and the beginning of the symptoms. Yeah, when you're awakened and your nervous system have issues, because as I say, when there is inflammation, there is some distress. The surrounding muscles, surrounding nerves, when they are silent, it makes sense, but I cannot really describe how it's what's the mechanism. I cannot say. For example, people sometimes have urgency. They don't have the urgency when they are wandering around, but when they come to home, when they take the key, it starts. It's related to nervous system, and it has some reflex effects. Awareness have some issue, but
I mean, for me, I don't have any urinary issue. The only issue is I get pain, sporadic pain after urination, after, and sometimes there is, like I said, my urine is very foamy for some strange reason, but negative test, but foamy urine.
This is for us a proof that it is related to the urinary system, because after urination you are having some issue. This is not muscular. This is related to urinary system.
Yeah.
Normally we are expecting it to be during the urination, but it differs from patient to patient. In your case, I have seen many cases like you too, but typical one is during the urination, dysuria. But you are after the urination. But it shows us there is the problems in the urinary system, and the only thing in the urinary system that will be constant, chronic, never healing is prostate. Bladder will heal.
I've had multiple cystoscopies, and they say that the bladder is totally normal.
Yeah, this is also a good sign that the bladder is safe, because in extreme cases, what I scare is the inflammation may pass from the prostate to the bladder. And in these cases, you will see the bladder is inflamed, reddish. The cystoscopy will tell it.
It said it was normal.
Yes.
Okay. I mentioned that when I first came here, that when I did a prostate MRI,
Yeah.
identified in the front area of the prostate
Yeah.
possible abscesses.
Yeah.
Do you feel that would have any bearing on
These
the
may
pain?
be the
or-
cavities.
Maybe the cavities.
Yes.
They called them collections. On the
Yeah.
MRI it said 2 collections.
Yeah, actually it's the same what we are talking about. But what I see we don't routinely do MRI, but maybe I have 100 MRIs I investigated for. I looked to MRIs for this disease, and generally it's not too big abscesses, but in the peripheric zone, in the capsule of the prostate, there are dark areas, little small tiny abscess-like inflammations are collected. Not big abscesses, but it's possible. It's also maybe yours is in that type. But in MRI, it's good to see these.
Yeah, as I said, it didn't show anything on ultrasound, only on MRI.
Yeah.
So the MRI is more detailed.
more
And it showed some peripheral inflammation and inflamed seminal vesicle,
Yeah. This
which the urologist in Dubai explained might cause why I was having some blood in my semen.
Yeah, yeah. If you have blood in the semen, yeah, it's infection of the seminal vesicles mostly, and normally seminal vesicles can heal more quickly. But when the inflammation is based on the prostate, they are neighbors, so the inflammation always hides in the prostate easily. So maybe they are reinfected and again and again.
Final thing is, what's your advice on masturbation?
Yeah, it's good
Some
question.
people,
and
some people to say always masturbate. Some people say no, don't do it too much.
we need drainage for sure. We need drainage, and you have to drain it. And for me, doing it every day makes some kind of addiction. And this you give a good level of hormone increase in the masturbation. So it's like smoking a cigarette or using a drug. If you do it every day, you will get addicted to it. Okay, you will just to sleep. You will need it.
Yeah.
So I don't like it to every day to do it because I don't want to take it into the rhythm of your body. But every 2 or 3 days is good, especially during this therapy. Every 2 or 3 days we recommend this.
Okay.
So other than your questions, I will say everybody needs repeated sessions. Sometimes if the disease is for 2 months to 1 year, a short time, maybe one session, 5 days will be enough. Overall, I think maybe 50% of the patients, it may be enough only coming here once, then just with antibiotics, such things. Or it can finish totally with these sessions. But in such cases, like we produced Enterococcus, you had a little longer story, it's better to repeat it at least one more time. I will be very happy if I can find a way for the people to do it self, because it's not easy to come. You can also try this, or have to come one more time.
I will come one more time for sure. And I'd like to say I've enjoyed the treatment, but it's been a little uncomfortable. But if it helps me, then that's the end game. So
yeah, and about to give some recommendation to people. You spent here just 1 hour, right?
1 hour
And
per day
after
for
the day
5
is
days.
for you. You can sightsee, go sightseeing,
I've
sightseeing.
seen all of Istanbul. Yeah.
It doesn't affect your day, and
No.
yeah, okay. Thank you.
One thing I didn't ask: the ozone.
Yeah, ozone is very popular nowadays for everything. To renew all the tissues for general health, for every chronic disease, everything. So I said, okay, why not buy this device and give it for free to everyone to make them the treatment success better. So we did it. We give it. For example, I myself use it. I have some chronic ear problem. I use the same. I give from rectum the ozone, and it heals my ear.
So it's for rejuvenation of cells.
Everything. So it makes oxygenation, and it gives some repairing of the old tissues. So it's for general health. It's very commonly used, and it's expensive. They charge a lot of money for it.
Why they charge extortionate amounts?
Yeah, maybe more than our old treatment price.
Yes, it is more than the whole package.
Yeah, so I said, okay, why not buy it and give it, and increase the success of the procedure. Yeah, thank you very much
Thanks,
for coming and
Nate.
joining
So I
us.
will try to come again, maybe in September. I think that's
This
with
is
my
good.
with business trips and stuff. So, and I'm hoping that within a few days or maybe next week, I start feeling
Yeah.
quite a lot better.
Thank you
Okay,
for
Josh.
sharing this with us.